Hello, hi everyone. My name is Paulina Ballesteros Galera, and I'm introducing to you pneumocytosis. And first of all, let's go ahead and get started talking about the anatomy of the lungs, which is where this fungus is triggered by. The respiratory system plays a vital role in maintaining homeostasis in our body. The respiratory system consists of basic functional divisions in air and conducting and a gas exchange. The air conducting system delivers the air to our lungs, while the gas exchange of the respiratory tract includes the lungs with their millions of alveoli and capillaries, which provides area for exchange of oxygen and carbon monoxide. Problems with ventilation or perfusion can cause either upper or lower respiratory functions. This problem can impair the ability to meet the body's needs. Pneumocytosis used to be classified as a protozoan, but is now considered a fungus. It used to be called pneumocystis carinii when scientists renamed it to pneumatosis aerobisi. Some people consider using the abbreviation PJP, but to avoid confusion, they abbreviated PCP. As you can see in the diagram, you see a healthy lung. In the letter 8, you see all the black spot. That's the gas exchange in our lungs, and you can see all the features in our body through the X-ray image. On the infected lung, you see all the white spots in there. Those is grow fungus in the lungs, and you can see also the capacity of the gas exchange is minimum compared to a healthy lung. So that's one of the main effects with this fungus. Most people who get PCP have medical conditions that weakens their immune system. Medications such as corticosteroids lower the body's ability to fight germs and sickness. Pneumocytosis is caused by the yeast-like fungus and is an opportunistic infection agent, developing an immunosuppressed patients. It is an airborne infection in the lungs. Despite modern intensive care with standardized strategies against acute respiratory distress syndrome, pneumocytosis pneumonia remains a life-threatening disease with a high mortality rates. Risk factors. People who has organ transplants, HIV, blood cancers, who take certain drugs for autoimmune diseases such as rheumatoid arthritis, inflammatory bowel disease, and multiple sclerosis. Some of the manifestations include short of breath or feeling short of breath, coughing up sputum. In several cases, they cough up blood. General feeling of feeling weak, achy joints, coughing, respiratory problems, hypoxia, low blood oxygen level, abnormal neutrophil count, which is the first defense to any virus, bacteria, or fungus in our body. Fever, chest pain, chills, fatigue, and if these symptoms remain untreated, an acute respiratory insufficiency and a possible death within a few days can happen. The diagnostic for PCP is using usually a mucus, either coughed up by the patient, called a sputum, or collected by a procedure called bronchial leakage, which is a method of lowering respiratory system in which a bronchoscope is passed through the mouth or nose in an appropriate airway in the lung, with a measured amount of fluid introduced and then collected for examination. Sometimes a small sample of lung tissue, a biopsy, is taken to for diagnostic. Some of the treatment for the PCP, despite of the classification of fungus, it is susceptible to several antibacterial and antiparasitic drugs that can be used for prevention of the infection among patients at high risk for PCP. The agent commonly used for prophylaxis is trimethoprim. It is an antibiotic used to treat bacterial infections. It works by stopping the growth of the bacteria. This antibiotic only treats the bacteria. Doctors treat infection with antibiotics either by mouth or IV for about 3 weeks. For severe symptoms, the doctor also may give a steroid medication, and a lot of the times this is oxygen, short-term oxygen depend, or it can turn life oxygen depend to the patients.